All right, I'm going to talk to you about the anatomy of the heart. So exciting. So first we have the apex of the heart, which is the bottom right here, and then we have the base, which makes up the great vessels. Now, speaking of vessels, we are going to talk about the vessels that supply the heart. So first we have the right coronary artery, and that goes to the right marginal artery, and that runs with the small cardiac vein. And then we have the left coronary artery, and that runs with the anterior interventricular artery, which runs with the great cardiac vein. And then we have the circumflex artery right there. And then in the back we have the coronary sinus. And then we have the posterior interventricular artery, which runs with the middle cardiac vein. All right, now for external anatomy of the heart. We have the right and left auricles of the heart for the atrium. And then we have the superior and inferior vena cavas. And then we have the ascending aorta, the aortic arch, which branches the brachiocephalic, left common carotid, and left subclavian arteries. And then we have the descending aorta. And then we have the pulmonary arteries, and then the right and left pulmonary veins. All right, and then we have the ligamentum arteriosum, and I think that's it for external anatomy. All right, now for blood flow to the heart. Blood from the superior and inferior vena cavas come into the right atrium. The atriums are aligned with pectinate muscle, and in the right atrium we have the SA node and we have the fossa ovalis. After coming through the right atrium, it will bypass the tricuspid or the right atrioventricular valve, and the valve is composed of chordae tendineae, and that is attached to the heart wall by papillary muscle. After entering the tricuspid valve, it will go into the right ventricle, which is lined with trabeculae carneae, both ventricles are. And then from the right ventricle, it will go through the pulmonary semilunar valve, which will go to the pulmonary arteries and go to the lungs to get blood to be oxygenated. And then blood will come back from the lungs through the pulmonary veins, which are these, into the left atrium. And then from the left atrium to the left ventricle, it is the bicuspid, mitral, or left atrioventricular valve. And that will go into the left ventricle. And then from the left ventricle, it will pump blood to the aorta through the aortic semilunar valve to the rest of the body. This is also the interventricular septum. And then the outer layer of the heart is the epicardium, this is the myocardium, and this is the endocardium on the inside of the heart. And I think that's it for that. I really hope I'm not missing anything. All right, now onto the respiratory system. So first we have the trachea, which has the C-shaped rings that don't go all the way around. And then the carina is where the trachea splits into right and left primary bronchi. And then these branches right here are secondary bronchi or lobar bronchi. And then these little colored branches are the tertiary bronchioles, which is also called the segmental.